Welcome back. I'm the Doc, Bob Lee, and our first guest is the founder and executive director of Health People. They join us today to discuss their community approach. It's a wonderful community approach to health. We welcome Chris Norwood to the show. Welcome, welcome, welcome.
Thank you, Bob.
Tell us about some of the wonderful things that you're doing.
Well, I think one of the most important, we do two things. The first is the way we do things, and we entirely train people from the community to deliver really evidence-based, effective health, self-care, and preventive education. I think the most important thing we've done with that is that we were engaged in an extraordinary fight against chronic disease, which we can see now how important that was. We had, with our peer educators, most of whom have diabetes themselves, they had managed to do the most community-based self-care education anyone ever had. They had put almost 2,000 people with Medicaid in a very effective 6-session course. And I do like, unfortunately, that was completely defunded, which also shows you, right while we're learning what these chronic diseases do. And that does kind of underscore that there's a, tremendous battle to bring real health to the Bronx and other communities.
Yeah. Now, you were working with the city and state trying to get them to take some steps to reduce chronic disease, especially diabetes?
Yes. We work with the city council to pass a law that the New York City Department of Health has to have a diabetes control plan for the city. It's actually the most widespread epidemic, more widespread than COVID, and they had no plan. So that's ridiculous. The city council had to pass a law to tell the health department to make a plan, which that's probably on delay now. We tried and tried and tried with the state, especially to look at ways to bring down amputation. The state amputation, diabetes-related amputation rate has gone up 60% since 2009. In fact, it's gone up so much for the last 3 years, they won't even put out the numbers, but it's
so you're saying that COVID-19 would have been more controlled had the city stepped in to head off diabetes?
With diabetes, also other chronic disease, hypertension. We didn't happen to be doing hypertension projects, but some people were, especially the public hospital system, they had a fabulous program they were doing with chronic disease nurses that really brought down out of control hypertension. All this was defunded just as COVID came in.
Yeah, so had they had a plan and it was funded, it would have been
absolutely.
Patients would have probably fared better.
They would have fared better.
Degenerative disease.
And one thing that's very important about the evaluation of what we've done, we did a couple of projects specifically in homeless shelters, which, as you know, the Bronx has more than its share of, and there's tremendous ill health in homeless shelters. And we brought down doing the diabetes self-management and also getting people and other services, making sure they were going to the doctor. We brought down the emergency room visits by 45% in 6 months. And I tell my peers, whatever else happens, you save people's lives by doing that, because they were not as much at the emergency rooms and hospitals just before this epidemic hit.
Yeah. So how has your work changed?
Well, it's like everyone else, everything's changed.
Yeah.
And,
from your point of view and from your organization.
It's a little bit hard because we like to interact with people, and encourage them and support them. But we're learning how to do that like everyone else on Zoom or other platforms, and letting people know we're back doing this another way, and enrolling them. And we're finding that people really want this kind of support and education. We also do a lot of HIV education and support. That, they, even if they're not used to using telehealth or whatever we call it, they will try and do it a new way too.
So, but you're using telehealth right now. People can call.
I guess we call it telehealth, or we call it Zoom health. I don't know.
Zoom health. This is the new way.
I should copyright that and sell it to them,
So a person, how would they would contact you, and then somebody would get on the line with them and talk about their health and some of the things that are bothering them?
We can't do it quite like that now because it's a little, I don't know. We put out that we're going to make a group, and we have them join the group, and then we set up the group, and we find out what of the people who want to sign up for that particular education course, what access they have. Some people don't have computers, or they don't have internet access. There's not a lot of internet access, say, in homeless shelters. So we figure out, some other way, and we'll let you know as we go along when we can do that more spontaneously and just respond to people like that.
It's still new. It's all new.
Mm-hmm.
It's a new normal, right?
Well, I want to say what I hope the new normal will be is really paying attention to health in ways that work. I hope that will be the new normal, because we can't keep doing this. It's not even with COVID, it's worse. But we can't keep having this kind of unavoidable mass chronic disease. Yeah.
So what message would you send to people that want to get involved in your organization?
Well, you can go on our website, healthpeople.org, and you can send us a message through the website. And just as we go along, look at ways to advocate for real evidence-based health education. If you're going to a clinic or hospital and you have a chronic condition, some do, but many don't, they should start offering you a course on how to take care of yourself. Some of this is very complex, but people can learn it rapidly.
Yeah, I think we have to get more into ourselves now than ever before, and pay more attention to our health. And we can go to your website to find out how to get more involved in your organization. Right?
Yes.
That website again is
healthpeople.org.
Thank you so much. Chris Norwood, founder and executive director, Health People. Thank you so much for your service, and thank you for your time.
Oh, thank you, Bob. It's wonderful to talk to you. It's like therapy for me. Not serious.
Well, thank you so much. Stay safe. Stay blessed.
All right. Bye-bye.
All right. We'll take a break. We've got more coming up next on Open.